Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Let's Talk. I'm Dr. Anita Raja, and like every week, this week we have a very interesting topic to discuss on our show today. As you know, March is a very special day because we celebrate Mother's Day in March. We also celebrate Facial Palsy Awareness Week in March. And I thought it might be pertinent for us to discuss this very vital topic because it is something that can happen to anybody. What is it? How does it affect people? All of this we'll discuss in today's show. If you want to be part of today's show, it's very, very easy. You can call us on 019-24231-083. The number is on your screens, or you could WhatsApp us on 07585-835-150. We're going to try and include your questions in our live show today. So on our show today, we have invited lovely, beautiful Dr. Tabassum Malik, who is a lifestyle physician and is such an inspiration. Welcome to our show, Dr. Tabassum.
Thank you so much. Assalamu alaikum, Anita, and assalamu alaikum to all the viewers. Thank you so much for having me.
Dr. Tabassum, first of all, I would like to ask you, what is a facial palsy and why is it so important to actually know about it?
Okay, so like you said, it can happen to anybody. In Urdu, it's actually called lakwa, and in Arabic, it's actually called shalal fi al-wajh. So for the viewers who are of Arabic or Urdu background. And what exactly is it? So basically, palsy is a shorter version. It's paralysis. And the paralysis can happen, it's a weakening of one side of the face. It can be a complete weakening of one side of the face, which I have, or a weakness of the lower part of the face that can occur in strokes, or it can be a paralysis of both sides of the face. And that is not as common, but it can occur. Now, why are we so worried about it? Why do we need to create awareness about it? Yes, you're absolutely right. It can happen to anybody. I ended up with it, being a doctor, having all the knowledge, etc. So it's so unpredictable as to, who can get it. The other thing is that there is no proper healthcare pathway in the UK. There are no proper guidelines for doctors. So the poor sufferers are left to research their own, go on to social media, go onto pages like mine on Instagram and other social media, who are sufferers, and, follow what they've been doing. Which can actually lead to, if they don't have proper somebody looking after them, they can lead to other worse consequences. So again, it's so important to create awareness. And the other thing which is so important is creating awareness about the facial palsy, so that when you see somebody with a visual difference, is to be kind and to acknowledge the fact that this is not just a cosmetic issue that people usually do think it is. And some doctors think it's just a cosmetic issue, but it's way, way more than that. And there is a charity called Facial Palsy UK, who every year they have this week called Facial Palsy Awareness Week. And the campaign comes up with a topic each year. And this year it was asking all the sufferers to tell the public about the little things that affect you with facial palsy every single day. Because those little things, they add up. I had somebody say to me, "Oh, shukr alhamdulillah, it wasn't a stroke," and I said, "Alhamdulillah, it wasn't a stroke." And I totally understand where they were coming from, that it's, alhamdulillah, you don't have something that is life-threatening. But to me, on an everyday basis, those little things that affect me because of the way my face is, can add up and can affect somebody's quality of life. So, would you like me to talk about the little things that affect me on a daily basis, just to create awareness? I'm happy to do that, Anita.
No, definitely, Dr. Tabassum, because I think it's very important to sort of understand that this is such a powerful sentence. This is not just cosmetic. It actually affects you. It gives you grief. It gives you pain. It is an inconvenience, and living with it is difficult. So I'd like you to tell us about the sort of hurdles you face, the difficulties you faced.
So, there are two types of facial paralysis. It can be temporary or it can be permanent. Unfortunately, mine is permanent, and it can, it's not just there as a static. It's not just there that this is facial palsy and that's it. What happens is that my face actually changes according to how stressed I am, what my mood is like. If I wake up, if I haven't had enough sleep, I will notice that my face is really tight. The facial muscles, like the other muscles of our body, they tense up, but even more so. So I have to be really careful, keep myself relaxed as much as possible so that my jaw doesn't get tense. And then it's very difficult for me to speak even at times, or even chew my food. Things like may have noticed that when I smile, my eye closes. So this is something called synkinesis. Now, synkinesis happens when as the facial nerve, which is the nerve that passes through from the brain, from the back of the brain, which is the brain stem, into the face muscles, basically, and it innervates the face muscles to help them move. And the facial nerve actually gets damaged in a facial paralysis. So basically, with myself, I have to be really careful that, I have to make sure that there is not enough stress. There is minimal swelling around my face, just to help the facial nerve keep healing. Now, in terms of synkinesis, I was talking about the synkinesis. What happens is, as the facial nerve starts healing, sometimes it misfires. It actually, so instead of, let's say, going to the mouth, the facial nerve ending might go to the eye, and then it'll stay there. And so when we're smiling, it will, the facial nerve innervation would go to the eye, so it misfires. And it's actually unfortunately permanent. But things like Botox can help ease the symptoms. So, when I'm outside in, when we're at a restaurant, if I'm eating, or even at a wedding, in Pakistani weddings, the camera is usually on you when you're eating. So, I have to be really conscious. You're conscious anyway when the camera is on you, but I'm even more so because, that side of my face, I can feel that, somebody's looking at it and feel quite conscious about it. And it's not just myself. There are lots and lots of people who I have spoken to with facial paralysis who unfortunately feel this way. Things like, when I'm going outside in the wind, my eye can get affected really easily. It can start just watering. And it took me a long time to start wearing contact lenses again. I'm short-sighted, so I have to wear glasses, and I actually don't like wearing glasses. I like wearing my contact lenses, and it's taken me a lot of training, a lot of relaxing the eye, and then start wearing the contact lens. But I've noticed that in the wind, it just pops out. And it's so embarrassing because I'm talking to somebody and it pops out, so I can only see with this one eye. So that's also something, that affects me on a daily basis. Again, when I was teaching my daughter to brush her teeth, rinsing the mouth, she actually thought that it was normal to rinse your mouth by holding the side of the mouth, because when I brush my teeth and I rinse my mouth, I'm unable to hold the water in my mouth fully. So I have to always hold it on the side. So it's a bit difficult. So my daughter used to think that it's normal to hold the side of your mouth while you're rinsing. But then I had to re-educate her and tell her, no, Beta, you have to rinse your mouth differently to how mummy does it. So those are the little things that add up, and they can affect you mentally and emotionally as well. So yeah.
And Dr. Tabassum, when you talk about mental and emotional effect of, living with facial palsy, are there any organizations out there that offer you the support? Do you think the NHS offers the support that it needs to patients who've got facial palsy?
Unfortunately, it doesn't. The reason being, there's not enough. As I said, there aren't any follow-up. There's not enough follow-up care. So then the emotional side is actually missed. But however, there are now some facial nerve clinics that have been sprouted about throughout the country. I don't have the list on me, but there is a list on the Facial Palsy UK site, which is a very, very helpful resource because it actually provides you with, wherever you are in the country, it can provide you with some form of support. They have group sessions where facial palsy sufferers can actually get together wherever you are and actually talk about things that are affecting you. So there is a support system out there. And as I said, with facial nerve clinics, there is a clinical psychologist specializing in facial palsy that is available at the clinics. So it's important that your GP can refer you to that as well. So that's available.
In terms of Facial Palsy Week, because you are actually living with it, how important was this week for you?
So important because there was not just for myself, it was important for all the other facial palsy sufferers, especially the ones that I have spoken to, because since I have started my facial palsy page advocating facial paralysis, I have noticed that there have been other sufferers, which is so nice, that have had the courage to come out and start their own page. And it actually brings about confidence for them and just creating more and more awareness, especially during this week. It's just been so good because when people come and ask you, okay, can you tell me a little bit more about what happened to you, and they are interested, it is you don't feel embarrassed, you want to tell them, so that, and they're like, oh really, I had no idea that it's not just a cosmetic issue, and the fact that it's affecting your life. Yeah, so that's how it's so important that the Facial Palsy Awareness Week was there.
Right. So viewers, stay with us. It's time for a break. Welcome back to Let's Talk. Before we were going on to our break, we were having this fantastic discussion around facial palsy and how we can spread awareness around it, how it affects people. It's not just about it being a cosmetic issue, but it is much more, it entails much more, and it can affect people in so many ways adversely. How we can cope with it is another topic that we are going to discuss in today's show. But before we go on to that, I am going to ask Dr. Tabassum a very vital question. Now, Dr. Tabassum, you have had facial palsy, and of course, you have lived with it and you are living with it. And I'm sure that there are many people out there who have given you unwarranted advice how to manage it, especially people from our community, our culture, who actually believe in lots and lots of myths around how to manage facial palsy. Would you want to sort of discuss some of these with our patients, share your experiences with our viewers?
Sure. Absolutely, sure. And first of all, our culture is a very, very caring culture. So we belong to the we have a Pakistani background, so all the cultures are lovely, but our culture more so, that everyone is very concerned with how you are, and they're trying to help. So I totally understand that they come from a caring point of view, but sometimes some people who don't know enough science, they can actually, and if somebody who is a layperson and is suffering from facial palsy, they may follow the advice and end up with adverse worsening effects of facial palsy. So things like I was told, don't look at a mirror, just don't look at yourself in the mirror for the first month, because you're going to get depressed, and I understood that. I get the logic behind it, but if you're not going to look at yourself in the mirror, how are you going to realize what your baseline was and how much improvement there is? So it is important to acknowledge and to accept that you have the facial paralysis, and you can only do that by looking at yourself in the mirror. The other thing is that, and I've noticed that in Pakistan and people who are of Pakistani origin and who are based in the UK, I've noticed that some people try and hide it, and they actually isolate the particular sufferer in a room, and they don't let them out until they say, oh, the lakwa is finished or the Bell's palsy has finished and it's gone, and then you can come out. There's no need to tell other people about it. But if you're not going to tell other people about it, how are you going to create more awareness so that these people are not stuck and they know when to get the help and what help do you get, and to gain from your experience. So I feel that it is important to not hide it. Some people feel that it's an embarrassment, and I don't think it's embarrassing. I believe that Allah gives us trials and tribulations for a reason. And, we're there to pass these tests, and inshallah, hopefully we all pass them. But it's also, to create awareness about it as well. The other thing I wanted to actually create awareness about was there are certain foods that people say that are good. I was told to eat, I don't know what it's called in English, maybe calves. The beef calves are called paya. So eating paya curry apparently is really, I enjoy it anyway, but apparently it's good for facial palsy, but I don't know the scientific reason for it. But if the viewers know anything, so please call and let us know about it, because I honestly don't know the background in it about it. And there's also some wazifas that people had said to me was to actually put pigeon's blood on one side of my face, on the affected side of the face. And I believe that it is a custom, and I'm not going to say anything wrong about it, because people have been doing this for centuries, because there are wazifas around it, etc. But I don't know the Islamic school of thought behind it, so I wouldn't want to comment on it. The other thing, what I was told was to chew gum. Yes, a very good friend of mine. She, she's of Indian origin, and she had Bell's palsy about 10 years ago. So she called me and she said, chew gum. Start chewing gum. Let's help your, help your facial muscles around the mouth start getting active. And I could understand this, the point behind it, but I didn't realize that at the time, it was advised. I later found out that it's advisable that we don't do any exercises, and we let the facial nerve heal by itself for at least a month. Because if you think about it, the facial nerve is bruised at the time. If you're going to actively move it, it's going to further cause more inflammation, and it's going to worsen, and it's going to cause synkinesis, something that I have. So I actually listened to my friend at the time, and I actually asked my husband to bring me back gum. And I chewed and I chewed, and it was painful at the time. Shouldn't have done it, but I wish I had known. So there are these kind of myths. So the other thing is that people who I know who go to Pakistan to get treatment for their facial nerve, they may get, so there are different schools of thought with regards to treating facial palsy. In the UK, it's not recommended that we use electrical stimulation on the face for the facial palsy as a treatment. But in Pakistan, I have noticed that people do get electrical stimulation to the face, especially in the first week, which I also feel that can be detrimental and cause synkinesis. So something what I have. So just to be aware of that. And always go to a trained physiotherapist or speech and language therapist that specializes in facial palsy, so that they can actually look at the facial muscles that need stretching or need any active exercise, because it's not just one rule fits all when it comes to facial palsy exercises. So that's also very, very important.
But you know,
So there's
Dr. Tabassum, you did your own sort of, research, and you looked for help actively. For people out there who still are looking for help out there, could you sort of signpost them? Because you did mention that there are a couple of clinics out there that are actually operating throughout the country.
So yes, of course. So first of all, if you do end up with facial palsy, please seek medical advice. Don't do anything by yourself. Go to A&E first of all, get investigated, get a diagnosis, get the treatment. There are lots of people who stay away from steroids because steroids is the mainstay treatment for any type of facial palsy, apart from the stroke. Um, you know, you know, it's a short course and it will not have long-lasting detrimental effects for you. Okay, number one. Number two, you were asking me to signpost. So Facial Palsy UK is a immense resource. It's full of it describes all the different types of facial paralysis and the causes behind it and the treatments. And it also has support groups in wherever you are in parts of the UK. So that's number one. Number two, so the facial nerve clinics, you can get referred to, I think there are about 12 facial nerve clinics in the UK. There's one in East Grinstead, there's one at Guy's St Thomas's, there's one in Oxford, there's one in Southampton. I'm sorry, I'm forgetting the others. But there is a whole list on my Facial Palsy page on Instagram. I've made a whole post around it. There's a whole list that you can refer to and get your GP to just do a referral to them. And they actually sit with a multidisciplinary team when they first see you. So once you get referred to them via your GP, you're seen by a whole team in one consultation. So you're seen by the facial plastic surgeon, you're seen by ENT, you're seen by a clinical psychologist, and then you're also seen by a speech and language therapist or a facial physiotherapist. And all four of them sit together and they discuss your case, they look at your MRIs, they see if you need an MRI, and they see what treatment you've had done, what treatment you need, and then they make a plan together with you. So I think it's really important in terms of follow-up that you get referred to these facial nerve clinics. And again, resources like my page, sorry, I'm doing a self-advertising, but at the Facial Palsy Doctor, I will always try and write posts about that have evidence base to them. So I look at latest research papers. I do. At the moment, I've got, 2 children to look after, alhamdulillah. So I'm trying to balance my social media input and family life. So I might be a bit slow in answering your questions. But I am available on inbox, DM me. But unfortunately, I can't give you direct medical advice as to what you should be having and making a management plan for you. That is your GP and your specialist responsibility.
And also in terms of private help, because I imagine the waiting times on the NHS are quite, I mean, they must be very long. So is there any sort of affordable private help out there as well?
So unfortunately, there isn't that I know of. There aren't any private Bell's palsy clinics in the UK that I know of.
Okay.
There are, again, you could go and see a private, the same consultants that are sitting in those, in the facial nerve clinics, you could see them privately. And actually, again, you could get information from Facial Palsy UK and call them up and they would be able to guide you which consultants are seeing patients privately. You'll be able to do that.
Right. Dr. Tabassum, we're left with our last 1 minute. So very quickly, a quick message for our viewers out there.
So just to create awareness that facial paralysis can happen to everyone. Just be kind to yourself, give yourselves a hug. You wouldn't talk to other people about how horrible they are. So why would you do that to yourself? Everyone is beautiful. Everyone's face is asymmetrical. But in facial palsy, it's more prominent. So just be aware, be kind to yourself, be kind to others. And just a Ramzan Mubarak to everyone, because Ramzan is coming up too, and Eid Mubarak.
Thank you, Dr. Tabassum, for taking our
Thank
time
you.
and coming on our show once again. Viewers, what a beautiful show. Be kind, look after yourself if you're suffering from facial palsy, and be kind to people around you. It's time to say goodbye. Have a lovely week. Take care. Allah Hafiz.